Every surgical procedure includes techniques that involve incisions, flap elevations, and flap retractions during surgery, and closing of the flap after the surgery. We'll take a look at the tools and techniques necessary in these steps. Preparing two types of surgical mesh during incision is recommended. Most people are familiar with mesh number 15, but using mesh number 12 is recommended in addition to number 15. Mesh number 15 performs an incision with surface contact, whereas mesh number 12 does so with point contact. In particular, performing a crestal incision with mesh number 12 allows us to create a clean incision line at once in an irregular bone environment. It may be unstable due to its point contact nature, but we can obtain a cleaner, more precise incision line if we move the mesh with a firm finger rest. After the incision, we must elevate the flap, and it's important to use a good periosteal elevator. The most frequently used periosteal elevator is number 9 mold, which has an extremely sharp side and an extremely large dull side. You'll be skilled once you've familiarized yourself with the tool, but the tool itself is far from perfect. The tool I use the most is a periosteal elevator called P24G. It's relatively thin and very hard. We can perform detailed flap elevations using P24G. This elevator allows us to perform significantly cleaner and easier flap elevations. I strongly recommend using this P24G periosteal elevator. It's important to retract the flap well during the surgery. Although surgery usually begins with the dental mirror in the left hand of a dentist or an assistant, holding the mirror during surgery is not recommended. You must perform the surgery with the retractor in the left hand to open the flap accurately and obtain a better surgical view. I usually use two types of retractors: Selden retractor and Minnesota retractor. It's better for the person in the mouth corner to hold the Minnesota retractor. Therefore, the dentist performing the surgery should hold the Minnesota if the surgery is on the right side, and the assistant should hold the Minnesota if the surgery is on the left side. In actual surgery, the retractor should always retract the flap after flap elevation to obtain a good surgical view. Most beginners have the hardest time with suturing. The most important elements of suturing are tools and basic technique. To discuss the tool, first, a good needle holder must be used for good suturing. A good needle holder offers a good grip and possesses very fine tungsten carbide coating on the retentive tooth. These properties allow us to make thin sutures. Likewise, take a moment to see if there is a bevel on the middle tooth. If there is no bevel, the suture will constantly be caught by this region. That's why you must use a needle holder with a bevel. If there is no bevel, make sure you create the bevel by grinding it yourself. It'll make the suturing procedure much easier. This pair of Adson forceps is also important. There are Adson forceps with or without a tooth. Although it appears that the tooth can grasp tissue more efficiently, it actually damages the tissue during surgery. So it's better to use the forceps without a tooth. I recommend using Adson forceps with no tooth. Recently, I organized a kit called Basic Surgical Instruments under my name. While giving lectures abroad, I experienced many difficulties during practical sessions due to the tools. So I organized this toolkit for easier surgery. It contains almost all of the contents I discussed above. Take a look. It contains a fine needle holder, Adson forceps without tooth, a Selden retractor, a Minnesota retractor, a P24G periosteal elevator, and a suction tip. I'm sure most of you had no problem with the suction tip, but it can cause some problems at times. So make sure you use an open metal suction tip. This tool is called an Auschenbein chisel, and it's my favorite tool. It's extremely useful in performing alveolarplasty or simply collecting the chin bone. So I included this tool here as well. It's not the complete full set, but these tools will allow you to perform most of the surgeries. If you add basic tools such as a mirror and a pin set to this, it'll be a great tool set. This is the actual tool set that I use. I added a few more tools to the basic tools I discussed above. I always carry this tool set when I perform live surgery abroad because it allows me to perform almost all kinds of surgeries. Add your favorite tools to the basic set for easier surgery. At this point, we'll watch the video of my actual surgery to see how to use the tools we just talked about. This is a slightly lingually placed incision. Now we make a lingually placed incision. I approach most of the incision lines with mess number 12. If you're not familiar with the tool, mess number 12 can be quite unstable.
저도 12번을 이렇게 루틴하게 쓰는 사람을 별로 본 적이 없어서 그러긴 한데
I had no problem with mess number 15 before I started using number 12. Once I got used to mess number 12, however, I could no longer make the incision I wanted with mess number 15. Although it can be difficult at first, you will learn that some incision lines cannot be created without mess number 12 once you're familiar with it. You can add a fulcrum to the frontal tooth and simply retract the flap using my favorite P24G elevator. Use this healthy tooth and push gently for easy retraction. The elevator doesn't push. Instead, it adds and rotates. It opens the gap with rotation. If you push incorrectly, you can lose control and stab. It's important to rotate with support for retraction and retract the lingual flap slightly as well. Perform just enough retraction to see the lingual bone thickness. This simple flap retraction completes a clean incision line. You can see everything this way.